We are going to deal about stomach today. So about stomach, first we have to see the abdominal organs. So to view the abdominal organs, we have to take out the layers which are present superficially. So we can remove the muscles seen in the abdominal region such as external oblique, and then after we are removing internal oblique on either side. Then we have rectus abdominis muscle upper part, and then we have transverse abdominis. So if we remove all the layer muscles, we will approach a peritoneal cavity, and then after we will approach the abdominal organs. Here a sheet is seen which we will call as greater omentum. So once you remove this greater omentum, we will approach the organs. So greater omentum is nothing but one among the peritoneal fold. So once you remove that peritoneal fold, you can approach the organs present. So we will remove the organs one by one to view the major organ of our study, that is stomach. To see stomach, we will be removing some important organs, such as here we can make out the organ which we want, that is nothing but stomach region. So only a part of stomach is seen. Other parts are hidden out by means of right side organ called liver, and left side we have a muscle called diaphragm. So these two are the things which are hiding out the stomach. So here in the lower part of stomach we have transverse colon. So we can remove the liver to view the stomach in better view. So we can see the major part of stomach now. So once we remove the costal margin, and along with that if we remove the diaphragm, we can see the full view of stomach. So this is the stomach. It is somewhat J-shaped, and if we are talking about the presence or situation, it is going to continue from the esophagus. The tube which we are seeing here is esophagus, and this esophagus, it is going to continue as stomach. So here we can see this clearly, and this thing we will call as esophagus, which is going to continue as stomach, and this stomach itself is going to continue as duodenum. So once we remove the gallbladder, you can make out the duodenal part as a continuation of stomach. So this is duodenum, which is going to come as a continuation of stomach. So it is present between the esophagus and duodenum in the proximal part, that of the foregut region. So this is stomach part. So talking about stomach, we have two orifices or two openings. One is above between the esophagus and stomach, we will call that as cardiac orifice. And another opening which is present between the stomach and pylorus will be called as pyloric orifice, which will be seen here. And this pyloric orifice can be made out by a vein called prepyloric vein of Mayo, and then we will be having two curvature, that is again we will be having lesser curvature facing towards the right side and greater curvature which is facing towards the left side. In the lesser curvature we have a ligament attached to it, and that ligament is called as lesser omentum. Along with that you can make out some vessels, and these vessels are nothing but left gastric vessels along with right gastric vessels anastomosing. And here in the greater curvature we will be having again one attachment which we will call as greater omentum, which will be having again anastomotic channel between left and right gastroepibulloic vessels. And then we will be having two surfaces. One is anterosuperior surface, which we are seeing now, which is again bounded, which we removed, like we will be having left margin which is bounded by diaphragm, and right margin bounded by left lobe of liver, and the lower part in empty stomach it is having relation of this transverse colon. And we are having another surface which we will call as postero-inferior surface, which is very important because many structures are related posterior to the stomach. So once you take out the costal margins, so costal ribs and all if you are taking, then after you can view some organs immediately anterior to costal ribs, such as we will be having spleen, and then we will be having left kidney along with left suprarenal gland. So these are also going to contribute for posterior-inferior surface of stomach. So relation, first thing is spleen, then we have left kidney and left suprarenal gland. Along with that we will be having some splenic vessels. So splenic vessel, we know from celiac trunk it is originating and it is reaching the spleen. So we'll be having splenic vein along with splenic artery. So splenic vessels will be related among among the structure of stomach bed. So stomach bed structure are nothing but posterior-inferior surface relation, and along with these structures we will be having another important organ which we will call as pancreas. So this is pancreas, which is also one among the content of stomach bed structure. So this, if you remove, we will see the posterior-inferior surface. Here we can see, so the surface which we are seeing now is posterior-inferior surface of stomach. So we have two curvature such as lesser curvature and greater curvature, and then we will be having two orifices. One is cardiac orifice, another one is pyloric orifice, and two surfaces, anterosuperior and posterior-inferior surface. And then again we will divide the stomach into three parts. Externally, such as an imaginary line horizontally will be drawn from the cardiac orifice, which we will call the upper part of it as fundus. This is the fundic part, which is related to fifth intercostal space. So fundus, the main content of fundus we will call as air. So if air is more in this fundic cavity, it will cause cardiac distress. As we know, fifth intercostal space will be having relation of apex of the heart. So if the air cavity got increased, it will cause distress in the apex of the heart, which will cause cardiac distress. And then we will be having below the horizontal line till the incisura angularis. Here we will be having a small groove-like area which we will call as incisura angularis. From where we will draw a vertical line, and from the vertical line till the horizontal line we will consider the part of stomach as body. And we will be having right side to the incisura angularis as pyloric part. So this body will be formed major part of the stomach, and later after the right side of the incisura angularis we will be having a canal-like area which we will call as pyloric area. This pyloric area again will be divided into two parts. One is we will call as pyloric antrum, and another, this canal-like part, we will call as pyloric canal. This dilated part is called as pyloric antrum, and this part is called as pyloric canal, which is again divided by a sulcus present here, which we will call as sulcus intermedius. So in this way stomach will be having its parts. Along with, if we are talking about arterial supply, it is supplied by lesser curvature with left gastric artery and right gastric artery, and greater curvature we have gastroepiploic vessels and the splenic artery which is passing behind, giving some branches for the fundus, which we will call as short gastric vessels. So all these are going to supply the stomach. So talking about lymphatic drainage, we have again divides the stomach into two halves, right and left half, and I will show you the drainage of lymph nodes in a diagrammatic representation. And we have to deal more detailedly about gastric triangular knot, and just for orientation this image is enough. So this is how the stomach is oriented in the abdominal cavity, and part of it is invaginated into the diaphragmatic part and reaching the thoracic cavity near to the fifth intercostal space.
So we are going to start about the stomach, which is a proximal part of digestive tract. So stomach, to talk about it, it is a most dilated part of the digestive tube, and it is going to intervene between the esophagus and the duodenum. So between the small intestine and the esophageal tube we have got our stomach. You know, in our abdomen we have got 9 regions which are divided by 4 lines. So we have got 2 lines which are passing vertically, and then we have got other 2 lines which are passing horizontally. So these 9 regions are going to carry some organs according to their places. So now we are going to deal about the stomach region. The stomach region, it is going to be present in the umbilical region. So this is the umbilical region where umbilicus will be seen. So this is umbilical region. So every organ have got their own regions to occupy. So we are dividing the abdomen proper into 9 regions by means of 2 vertical and 2 horizontal lines. and these two vertical lines are drawn at the mid-clavicular level, and these two horizontal lines are drawn such as, this is drawn as transpyloric line, and the lower one we will call as transtubercular line. So these are the four lines which is going to divide the abdomen. Now as we are learning about stomach is going to occupy the umbilical region, which is the middle part, and then above that we have got another region called epigastric region. So we have got epigastric, and this is umbilical region, and this region we will call as hypochondriac. Here we will have ribs present over. So just below the ribs, so ribs will be related over here. Just below the ribs the region is present, and it is seen in the left side. So this is the right side, and consider this as left side. So in left side below the ribs, this region we will call as left hypochondriac region. So this is left hypochondriac region. So these are the three regions where we have got our stomach placed. So stomach, it is having a shape in such a way like J, which is going to occupy three regions of abdomen. Just like this. So the stomach region, it is occupying the epigastric region, left hypochondriac region, and umbilical region in this way. So this is the placement of stomach in the abdomen, occupying the three regions. Now we are going to deal about the parts of the stomach. So we are going to see three important parts of stomach, such as we have got two orifices. So this is a above orifice, and this we will call as cardiac orifice. The lower one we will call as pyloric orifice. The cardiac orifice is an opening which is going to be a continuation of esophagus. So here we have got esophagus, which is going to continue as stomach's cardiac orifice or end. So we have got proximal line and distal line. Proximal line we are calling by a name called cardiac orifice. So this we will call as cardiac orifice. And then we have got the distal end or distal opening, we will call this as pyloric orifice. So this is pyloric orifice. So these are the two ends we have got in stomach as first part we are dealing, and this pyloric orifice, it is going to continue as duodenum. So it is going to continue as small intestine, that is duodenal part. So that's all about the stomach's proximal and distal end. And then we have got two curvatures present, that is between the proximal and distal end. Towards the right side we have got a smaller curvature, and this curvature is called as lesser curvature, and the left side we have got another curvature or curve of the stomach which is facing the left end, and that is called as right greater curvature. So this is the two curves we have got in stomach. One is towards the left side, another one towards the right side. Left side we have got concavity, on the right side we have got convexity, and this is considered as left curvature, and this one is considered as greater curvature. And then we have got two surfaces. The surface which we are seeing over here, that is and the anterior aspect, we will call that as antero-superior surface. So this is antero-superior surface which we are seeing, this whole part. Behind that we have got postero-inferior surface. So these are the parts of stomach we have got, such as two ends, two curvatures and two surfaces. And now we will deal with the anatomically how we will divide the stomach into parts, such as we have got three areas for the stomach, such as fundus, pylorus, and then the body part. So those things we will deal now. So now we are going to deal with subdivisions of the stomach. So we have seen parts of the stomach such as two ends, two curvature and two surfaces. So now we are going to deal with subdivisions of stomach. So subdivisions of stomach we are going to deal. So stomach we have got, the subdivisions are namely 3, as we have got upper part called as fundus, middle part called as body, and the lower part called as pylorus. The way we divide is, this we know this is the cardiac orifice or opening. Below that you can make out a notch or a depression over here between the cardiac orifice and the greater curvature, and this is known as cardiac notch. So this is cardiac notch. Along the cardiac notch we have to draw an imaginary line. So if you are drawing an imaginary line just below the cardiac notch, the part of the stomach which is present above it is called as fundus. So this is the fundic part of stomach. And then we have got another notch over here, and that we will call as incisura angularis. So incisura angularis, it is seen in the lesser curvature, and this is a depression over here. From the incisura angularis again we have to draw an imaginary line where we will be having a greater curvature with a notch, and this part is going to divide, or this line is going to divide the body from pyloric part. So this is the body of stomach, body, and then distal to it we have got pyloric part. So this is pylorus or pyloric part. So this pylorus again we can divide by means of another sulcus which is seen between the pylorus, that is sulcus intermedius. Sulcus intermedius, which is we will call as pyloric antrum in the proximal part and pyloric canal in the distal part. So this is how we will divide the stomach region, such as above part fundus, the middle part body between the fundus and pylorus, and distal to the body we have got pyloric region, which we will again divide by means of sulcus intermedius into pyloric antrum and pyloric canal, and here we have got pyloric orifice in the distal part. About fundus to talk, fundus, it is a part which is filled with air when the stomach is empty also. So if substance is present in stomach or else if it is empty, both time we have only air seen over here, and it is going to relate with the left cupula of diaphragm just up to the level of fifth intercostal space, that is towards the apex beat of the fifth intercostal space where we have got heart's apex. So till there it will going to extend, and this whole region is called as body. And then we have got pyloric part, and the pyloric orifice, here we will get a vein called prepyloric vein of Mayo. So in living condition we can see a vein passing just above the pyloric orifice, and that vein we will call as prepyloric vein of Mayo. So this is prepyloric vein of Mayo. And then we have got this pylorus part again divided into antrum and canal by means of sulcus intermedius. This pylorus whole thing, it is divided by body by means of another sulcus or another imaginary line drawn between incisura angularis and a notch in greater curvature. We will have this imaginary line dividing the body from the pylorus. So these are the subdivisions of stomach we have. So now we are going to see anatomical detailed description about stomach. That is, first we are going to deal about parts of the stomach. So we have got parts of the stomach under some subheadings, such as we have got two orifices. Orifices in the sense we will be having some openings. So orifices, and then we have got two curvatures, and then we have got two surfaces, and then we are going to divide externally the stomach into three parts or three subdivisions. So we have got these many parts in the stomach region. So about each part we are going to see in a detailed account. Before going to the detail, just I will explain what are the orifices we have in stomach, curvature, surfaces and subdivisions. Talking about orifices, we have got two orifices. One is cardiac and another one is pyloric. So we have got cardiac orifices and another one is pyloric orifice. This is the proximal orifice and this is the distal orifice, which is a continuation of esophagus, this cardiac orifice. Pyloric orifice is going to continue as duodenum. And then we have got curvatures. To talk about curvature, we have got again two in number. One is lesser curvature and the one is greater curvature. This lesser curvature is facing towards the left side. Lesser curvature is facing towards the right side, and then we have got greater curvature which is present in the left side. And then we have got two surfaces. One is antero-superior surface and postero-inferior surface. So these are the two surfaces we have got. So orifices, two in number, cardiac and pyloric, curvature, lesser and greater curvature, and surfaces, antero-superior and postero-inferior surface. And talking about subdivision, we have got three subdivision, such as we have got fundus of stomach, body of the stomach, and pylorus of stomach. So these are the three parts we have got as a subdivision of stomach. Now we will get to see about the orifices first. So talking about the orifices, we are first going to see about the cardiac and pyloric orifice. So first one we are going to see about cardiac and pyloric orifice. So first thing we are going to see about the orifices. So about orifices we are going to see in detail. So we have got cardiac and pyloric orifice. Already as I mentioned, we know the location of stomach. So when we draw a median line in the body, we are drawing a median line in the body, and here to consider the cardiac orifice, it is about 2.5 centimeter left to the midline. So left to the midline 2.5 centimeter away, we have got an orifice present. And that orifice is nothing but cardiac orifice. So we have got an orifice present 2.5 centimeter away from the midline of our body, and that orifice is cardiac orifice. So this is cardiac orifice, which is continuation of esophagus. So this is going to continue like this. So this is the cardiac orifice we have got. And talking about pyloric orifice, from the midline towards the right side 1.25 centimeter right side to the midline. So this is the median line of both the things. From median line 2.5 centimeter left side we have got cardiac orifice, and towards the right side 1.25 centimeter we have got the pyloric orifice. So this is how we have got our orifices placed. So this is the pyloric orifice. So this pyloric orifice in living condition, it is identified by means of a vein passing above it. So above this we will be having a vein passing, and that vein is called as pre-pyloric vein of Mayo. So this is the vein which is seen in living condition, not in a cadaveric condition. So by seeing the vein we can make out where the pyloric orifice is exactly present. And the angle present over here we will call that as incisura angularis, so that we can understand from where we have got divisions of body and pylorus present. So this angle part is incisura angularis. So that's all about the detail of cardiac and pyloric orifice we have to know. Now we will move on to curvature of the stomach. So we are going to deal about the curvature of stomach. So curvature of stomach we are going to deal now. So we have got, as we mentioned earlier, we have got two curvature. One is lesser curvature and then one is greater curvature. So first we will move on to lesser curvature of stomach. As I mentioned earlier, lesser curvature, it is seen facing towards the right side. Greater curvature will be seen facing towards the left side. So I am showing here. So consider this as a stomach region. So in stomach we have got this part has lesser curvature. So the curvature or curve which is facing towards the right side, we are calling that as lesser curvature. And this part which we have is greater curvature. Greater curvature. So this is lesser curvature and this is greater curvature we have got. This lesser curvature have got an attachment of the peritoneal fold, and that attachment or ligament attached to the lesser curvature, we will call that as lesser omentum. So we have got a ligament attached to the lesser curvature. So this is the ligament which is getting attached to lesser curvature. We will call that as lesser omentum. And towards the greater curvature, here I have to show. So here we have got a bulging which is present over here, and then it is going to continue as a curve, and this part is called as fundus of the stomach. So this is fundus of the stomach, and this whole thing is body of stomach, and here we have got pylorus part. So these are the three subdivisions we have got. So near to the fundus we have got two ligaments attached. One is to the diaphragm, another one is to the spleen. So that curvature here, this greater curvature, one which is going above, we are calling that as gastrophrenic ligament towards the diaphragm. So we are calling that as gastrophrenic ligament. And then from the fundus to the spleen we have got another ligament, and we are calling that ligament as gastrosplenic ligament. Gastrosplenic ligament, which is passing from the fundus to spleen. And the remaining part of curvature, the whole of the vast area, it is giving attachment to whole of greater omentum. So we have got this whole region which is giving attachment to a ligament called greater omentum. So these are the ligaments attached to the curvature. So we have got lesser curvature facing towards the right side and greater curvature towards the left side. Lesser curvature with a ligament called lesser omentum, greater curvature with three ligaments attached from above downwards, gastrophrenic, which is getting connected to the diaphragm. Another one is getting connected to the spleen, and another one is greater omentum. It is a peritoneal fold. Along with that, this lesser curvature, it is related to anastomosis between two arteries. So we have got arteries anastomosing in the near to the lesser curvature, that is gastric arteries. We have got right and left gastric artery. So this is left gastric artery and this is right gastric artery, which is anastomosing at the level of lesser curvature. Same way in the greater curvature, near to that we have got again two more arteries getting anastomosed. So those two arteries are again left gastroepiploic artery and right gastroepiploic artery. So this is how we have got curvatures relation with their attachment. Now we will move on to surfaces of the stomach. So to talk about the surface of the stomach, you already know we have got two surfaces seen. So surface of stomach, we have got two, such as antero-superior and postero-inferior. So antero-superior, it is related to some structures, and postero-inferior, it is related to many structures. So first we will move on to antero-superior surface. Antero-superior surface. Talking about antero-superior surface, we have got some structures related to it. First we will move on to the relation of antero-superior surface. So we have got stomach in this way, we have got fundus over here, and this is the body, and this will be the pyloric part, which we already know. Now in the antero-superior surface, we are going to divide into right part and left part. So here in the right side we have got a relation of liver. So we have got liver related here. So we have got liver relation present over here. So whole of the liver will be related towards the right side of the anterosuperior surface. Talking about the left side, we have got costal margin present over here. So we have got costal margins over here. Along with that, we will be having a part of diaphragm also related here. So we have got a muscle called diaphragm. Along with that, we will be having below that an organ, and that is called spleen. So spleen also will be related. So spleen and the diaphragm and also the costal margin. These are related towards the left side. And then below that, we will be having in the lower part the colon, that is transverse colon will be related in the lower part. So here we have got transverse colon relation. We know we have got large intestine with ascending colon, transverse colon and descending colon. In the transverse colon, upper part will be related the lower part of anterosuperior surface. So these are the structures related to the anterosuperior surface of stomach. So you can see here a triangular area. So this is considered as a triangular area of stomach, which is related directly to the anterior abdominal wall. And this part or this triangular area is called as gastric triangle. So this is gastric triangle region. So talking about the relation, we have got liver as first relation, and towards the left side we have got spleen, diaphragm and costal margin, and towards the lower side we have got transverse colon. So this is fifth relation. These are the relations of anterosuperior surface. Along with that, a small part of the stomach, it is directly getting related to anterior abdominal wall, and that region is called as gastric triangle. The importance of gastric triangle is the boundaries we can make out same like that. We will be having superiorly on towards the right side we have got liver, inferior border of liver, left side we have got costal margin, lower part with transverse colon. And the importance of this triangular region is during esophageal obstruction, we will be introducing the tube for feeding through this triangle. So that's why gastric triangle is considered as an important region which is not having any relation with the other organs, which is directly related to anterior abdominal wall. So gastric triangle is an important feature we have to mention. Now we will move on to trough space. So trough space is nothing but the space which is seen in the fundus region. So space which is overlying towards the fundus, we will call that as trough space. And this trough space, so now we are going to see about posterior surface of stomach. So we have seen about the anterior surface and the other parts such as cardiac, pyloric and those details and all. Now we are going to move on posterior surface of stomach, which is also known as stomach bed structures, because this posterior surface is related to so many structures or so many viscera. So we are considering this posterior surface otherwise as stomach bed. So otherwise it is considered as stomach bed. Now this stomach bed is going to carry many organs in detail. So those organs are, first we have got in between area which is having pancreas in it. So here we have got our body of pancreas related. So in this part we have got our pancreas related. So we have got pancreas related over here, and then we have got, this is body of the pancreas, and near to the pancreas at the tail we have got one more organ related, and that organ is called as spleen. So we have got body of pancreas and a part of spleen related over to it, and then we have got near to the spleen, that is in the posterior aspect, posterior most aspect, we have got left kidney related. You know, the stomach is most of the part of the stomach will be seen in the left side. So left side organs are what we are going to see here in the stomach bed structure. So body of pancreas which is going to pass towards the left is seen over here in the posterior area of stomach, and then we have got spleen, part of spleen and part of left kidney related. Just above the left kidney we have got our left suprarenal gland also related. left kidney with left suprarenal gland, and here we have got pancreas. In pancreas we have got a border called anterior border of pancreas. So from the anterior border of pancreas we have got some peritoneal fold of transverse colon, that is peritoneal fold of transverse colon called as transverse mesocolon will be attached to this. So anterior border of pancreas is related to transverse mesocolon, and then we have got the upper aspect some fibers of diaphragm, that is left crus of diaphragm will be related over here. So we have got some fibers arising from the vertebra's left side, lumbar vertebra left side, that is left crus of diaphragm, which is related over here. And related to the superior border of pancreas we have got an artery related, that is near to the pancreas tuberomental. Here we have got celiac trunk placed. From the celiac trunk we have got an artery arising and going towards the upper aspect of the pancreas. So that artery is called as splenic artery. So this splenic artery is also going to end up near to the tail of pancreas, near to spleen. So we are calling this as splenic artery. So splenic artery is also a structure which is related over here. So these are all the things which are giving relation to the posterior surface of stomach. I will summarize again. First thing is we have got from above downwards we are going. The first structure what we have got is left crus of diaphragm. Left crus of diaphragm, and then what we have got is artery, that is splenic artery. So second one is splenic artery. And third structure related is, here you can make out kidney with left suprarenal gland. So we have got third as left suprarenal gland, and the fourth one is left kidney, and the fifth one is, here we have got spleen, and sixth one what we have is body of pancreas. So sixth one is pancreas body, and the seventh relation is the transverse mesocolon which is attached to anterior border of pancreas. So transverse mesocolon. So I have shown dotted lines of stomach and the structures related behind it. So those are the structures which we are seeing here. Around 7 structures are seen just behind the stomach, which is going to give the importance of posterior surface as stomach bed. So it is acting as a bed for the structures to accommodate there. So now we will move on to blood supply of the stomach. So these are about the details of surface and the relations of the stomach. Now we are going to see details of arterial venous drainage, that is blood supply of stomach. So now we are going to see about blood supply. So blood supply, if you are seeing, we have got 2 things to deal with. One is arterial supply. So we have got arterial supply, and then we have got venous drainage. Venous drainage. So now talking about arterial supply. First we have got arterial supply. So this is stomach. So in stomach we have got, again this is fundic part, and here almost somewhat here we have got our celiac trunk placed. So from the celiac trunk we have got 3 arteries arising. So first artery which is arising is left gastric artery. So we have got left gastric artery which is arising from celiac trunk, and then we have got an artery which is passing through the stomach posteriorly, and that artery is called as splenic artery. So here we have got splenic artery which is passing behind the stomach. Just now we have dealt. Then the third artery what we have is common hepatic artery, which is again dividing into 3 branches, such as we have got again right gastric artery, one branch is right gastric artery, and another one is gastroduodenal artery, and then we have got proper hepatic artery. So these are the 3 branches we have got. right gastric artery, gastroduodenal. So this is right gastric artery, gastroduodenal artery, and this is proper hepatic artery, and this one is common hepatic artery. This is left gastric artery, and this one we know splenic artery. So now the branches from all these things are going to supply the stomach. Like, so in the lesser curvature we have got two arteries supplied by left gastric and right gastric artery, which is coming from celiac trunk. So celiac trunk. Now we have got greater curvature. So in the greater curvature we have got again left gastroepibloic, which is coming from splenic artery. So we have got left gastroepibloic coming from splenic artery, and gastroduodenal artery, it is going to give one branch which is going to anastomose in the greater curvature, and that is right gastroepibloic artery. Right gastroepibloic and left gastroepibloic are going to anastomose with each other. It is from splenic artery and this is from gastroduodenal artery, which is again a branch of common hepatic artery. Now we have got some branches arising from the splenic artery to supply the fundus of stomach. So those arteries are short gastric artery. It is going to supply the fundus part of stomach. So these are short gastric artery. And one branch from splenic artery which is going to supply the posterior aspect of the stomach, and that is called as posterior gastric artery. Gastric artery which is going to supply posterior surface. So in this, for arterial supply we have to remember we have got 6 arteries altogether. So in lesser curvature we have got left gastric artery and right gastric artery, so 1 and 2, and we have got left gastroepibloic artery and right gastroepibloic artery in the greater curvature, and then we have got short gastric artery to supply the fundus of stomach. Then we have got posterior surface of the stomach supplied by posterior gastric artery, which is again a branch of splenic artery. So these all about the branches of or arteries which is going to supply the stomach we have. Now we are going to see about the venous drainage. So talking about venous drainage again. So if we are talking about venous drainage, we have got corresponding veins, that is same arteries how it is supplying, same way we have got veins with same names. So we have got again stomach. For venous drainage we have got an important vein which is going to drain all these things. So the vein which is going to drain us, we have got portal vein. So we have got portal vein which is going to be formed by 2 veins. So we have got portal vein. So this is portal vein, and it is sorry about this. We have got portal vein which is formed by superior mesenteric vein and the splenic vein. So this is splenic vein. So both these veins are combining together, superior mesenteric and the splenic vein joining together to form this trunk called portal vein. Now we have got left gastric and right gastric accompanying veins. So left gastric vein and the right gastric vein are going to drain directly into this portal vein. That is the accompanying veins for the lesser curvature. So lesser curvature is drained by left gastric vein and right gastric vein, which is draining into portal vein. Then we have got right gastroepibloic vein. So right gastroepibloic vein and the left gastroepibloic vein. So left gastroepibloic vein is going to accompany the left gastroepibloic artery, is getting drained into splenic vein, and here right gastroepibloic vein is getting drained into superior mesenteric vein. So we have got these two getting drained in different places, and then we have got short gastric veins which is going to supply the fundus, is getting drained into splenic vein again. So this is the drainage of the stomach. We have got venous drainage of stomach. These are short gastric vein. So left gastric and right gastric draining into portal vein, right gastroepibloic to superior mesenteric, left gastroepibloic to splenic vein, short gastric vein to splenic vein again. At last all these veins are getting drained into portal vein. So these all about the blood supply of stomach we have got. Now we will move on to nerve supply and lymphatic drainage of stomach. So first we are going to see about lymphatic drainage of stomach. Again we have got some group of lymph nodes. So lymphatic drainage we are going to deal. Lymphatic drainage. So about lymphatic drainage to talk, we have got again a stomach. So we have got our stomach. Here we are going to see lymphatics under some division. So we are going to divide the whole of the stomach into two parts by a vertical line. So we are going to divide this into two parts, two halves, right and left half. So this is right half and this is left half. In the right half again we are having upper 2/3 and lower 1/3. A horizontal line we are drawing to divide into upper 2/3 and lower 1/3. First we are dividing into right and left half, and then in the right half again we are drawing a horizontal line which is dividing into upper 2/3 and lower 1/3. And then near to the incisura we are having pyloric end. So this pyloric part we are dealing separately for the lymph nodes drainage. So this is how we are dividing for the lymphatic drainage. Now we are going to see what are the lymph nodes present for the drainage of the stomach. So first we have got, for draining the left half of the stomach, we have got a lymph nodes which is carried to the pancreatic splenic junction, that is pancreatico-splenic lymph nodes, which is seen between the junction of tail of pancreas and the spleen, hilum of spleen. So these lymph nodes are called as pancreatico-splenic lymph nodes, which is going to drain the left half of stomach. So left half of stomach is drained by pancreatico-splenic lymph nodes. And coming to the right half, we have got upper 2/3. So the upper 2/3 part is getting drained into, here we have got left gastric artery. Relating to the left gastric, we have got left gastric lymph nodes. So here we have got left gastric lymph nodes. So here we have got left gastric lymph nodes. Here the upper 2/3 is getting drained. So whole of the upper 2/3 is getting drained into left gastric lymph nodes. And then coming to the lower part, the lower 1/3, here we have got right gastroepibloic artery passing. Near to that we have got some group of lymph nodes called as right gastroepibloic lymph nodes. So here we have got drainage of lower 1/3. So lower 1/3 is getting drained into right gastroepibloic lymph nodes. Now we have got pyloric part. This pyloric part is getting drained into three areas. One is, we have got liver here. Near to the liver, it is somewhere here we have got liver, and here we have got a group of lymph nodes called hepatic lymph nodes. So this is hepatic lymph nodes. So hepatic lymph nodes, and below the pyloric part we have got another group of lymph nodes called as pyloric lymph nodes itself. Pyloric lymph nodes. And then we have got some lymph nodes going to the left gastric lymph nodes. That is, the pyloric part is getting drained into three places. One is to hepatic lymph nodes, another to pyloric lymph nodes, and then to left gastric lymph nodes. So three way of drainage is seen in the pyloric part. So we are talking about pyloric aspect. In pyloric aspect we have got lymph nodes draining in three areas. One is to hepatic, another one to left gastric, and then to pyloric lymph nodes. Now all these lymph nodes are again getting drained into celiac lymph nodes, which is seen in the near to the celiac trunk. So this is about the lymphatic drainage of stomach we have got. We are dividing into right and left half. Left again we are dividing into upper and lower, and then we are dealing with pyloric part separately. Now we will move on to nerve supply of the stomach. So we are going to see about nerve supply. Nerve supply of stomach. So talking about the nerve supply of stomach, we have got again sympathetic and parasympathetic means. So we are having sympathetic and parasympathetic. Parasympathetic is mainly by vagus nerve. Again we have got anterior and posterior trunk, we will deal in detail. Sympathetic is mainly by T6 to T9 sympathetic nerves, which is going to end up in celiac plexus, and then it is going to supply the stomach. Now we are going to see details of parasympathetic, that is vagus nerve. So talking about this vagus nerve, again it is divided into anterior and posterior vagal trunk. Anterior vagal trunk and posterior vagal trunk. So now the anterior and posterior vagal trunk are nothing but left and right vagus only. So in the thorax region we have got right and left vagus nerve. So now we are going to see about these two vagal trunks separately. We are going to see as first about the anterior vagal trunk, and then we are going to see details of posterior vagal trunk. So now we will deal with these two. So talking about anterior vagal trunk, that is nothing but left vagus nerve. First we have got vagus nerve, which is dividing into right and left vagus nerve. Right vagus is going posteriorly. So this is right vagus nerve, which is going to run posteriorly. So we will call this as posterior vagal trunk. This is left vagus nerve, which is going to run as anterior aspect of stomach. So we are calling that as anterior vagal trunk. So this is going to pass below. So it is going to come forwards. So after coming, it is going to reach the lesser curvature. Near to the lesser curvature, it is going to divide into two divisions. One is gastric branches. So it will give many gastric branches. Another one is to the liver, that is hepatic branch. So we have got hepatic branch and gastric branch, and here hepatic branch again will divide into ascending and descending branch. Ascending branch and descending branch. And gastric branch, it will again give many small branches to supply whole of the anterosuperior surface of stomach. So we have got this as anterior vagal trunk, and it is giving branches such as, here we have got gastric branches, and this is hepatic branch, and this hepatic again dividing into above and below. Ascending branch, which is going to supply the liver, and descending branch is nothing but pyloric branch. Pyloric branch, otherwise known as descending branch, going to supply the pyloric part of stomach. The other parts of the lesser curvature anterosuperior surface is supplied by gastric branches. So these are all the gastric branch. So the branches will give a crow's feet like appearance, and this nerve, which is bigger among this, is called as nerve to letter jet. So the nerve which is going to supply major area of stomach is called as nerve to letter jet. Nerve to letter jet, which will give a appearance like crow's feet. So this is about anterior vagal trunk, how it is supplying the anterosuperior surface of stomach. Now we are moving on to posterior vagal trunk. So as I said, right vagal trunk, it is passing behind as posterior vagal trunk. So posterior vagal trunk, it is again going to give two branches. Before reaching the stomach, it will give one branch to celiac plexus. So it is going to give contribution to celiac plexus, and then the posterior vagal trunk, it will come downwards, and again it will reach the lesser curvature. So here it is going to give one branch to fundus separately, and then it is going to divide into many small branches. It will divide into many small branches like this. So this is how it is going to supply the postero-inferior surface of stomach. So this is the postero-inferior surface. This is again nerve to letter jet, and this is having one branch first before reaching the stomach, that is celiac branch, and another one is gastric branch, and here one special branch for fundus of stomach, we will call that as nerve to Graci or nerve of Graci, that is only for fundus of stomach. The remaining branches going to supply the posterior-inferior surface of stomach. So these all about the details of nerve supply of stomach, anterior vagal trunk and posterior vagal trunk. And talking about the clinical aspect, we have got condition like gastritis and many clinically oriented relevance, and we have got embryologically many cases happening according to their development, gastrointestinal tract development, rotation wise and all, so that we will deal along with embryology part. Now these all about the details of anatomical features of stomach what we have. Thank you for listening.